Hi, my name is Carl Freeman, student nurse at Miles Community College. Today we're going to be doing our third video, which we're going to be giving Dilaudid through the IV port, and then we're going to be discontinuing the IV. So the first thing to go through is the 6 rights of medication administration. You have right patient, right drug, right route, right dose, right time, and right documentation. Our next step is always to compare our MAR with our physician orders. The physician orders state give Dilaudid 2 milligrams IVSP every 2 hours as needed for complaint of pain. It also states that each milligram of Dilaudid administered should be diluted with 2 milliliters of normal saline. So if we're giving 2 milligrams of Dilaudid, we need 6 milliliters of saline. Okay. Our next step is to perform hand hygiene, and we're going to apply gloves. We're going to identify the patient using 2 identifiers, and we're going to explain the procedure. Mr. Needed has given us his name and date of birth. We're going to check the patency of the IV. We're going to look for any problems there. And we're going to expose the catheter hub and loosen the tape. Sorry, I'm having problems with the tape. So we're going to lock this. Okay, next step should always be to clean the flush lock with alcohol. Apply a gauze underneath. And once the port has dried, we are going to flush 15 milliliters of normal solution. So we're going to do 5, which is half of this. So we gave 5 there. We're going to teach the patient how to maintain the lock for the time being. We're going to set up. And we also need to document everything that we've just done. So we'll go to the computer and we'll document. We're going to review physician orders and MAR for the drugs to be administered. So Dilaudid, this is 6 milliliters of normal saline. I'm having problems today opening stuff. So we're going to be giving this medication over 2 minutes. Well, since we're giving 2 milligrams, we're actually going to be infusing it over 4 minutes. We're going to add air, the appropriate amount of air. We're going to aspirate the air into the bottle of Dilaudid. We're going to pool the appropriate amount. We're going to take a new alcohol wipe. We're going to wipe the normal saline. We're going to recap it for the time being using the no hand method. Next, we're going to prepare to flush. So we flushed this with normal saline. We're going to, after we draw it up, we're going to clean the medication port again. And at the same time, you want to assess for patency of the IV site. So we've administered the 5 milliliters. We're going to inject the medication very slowly over 4 minutes. You want to be monitoring the patient for any adverse reactions such as infiltration or phlebitis. Ask him if he has any pain. Okay, we're going to throw this in the sharps container. We're going to flush the other 5 milliliters into the IV. Something's wrong with my IV, so we're going to say that it went. Okay, the next step is to, you want to continue to monitor your patient. And we cleaned it. And now we're going to dispense of our garbage. We're also going to label the medications with the name, date, time, all the information needed in case we need it again later. Okay, and then we're going to document all our pertinent data. Our next step is I'm going to remove my gloves. I'm going to perform hand hygiene. And I'm going to don new gloves. I want to make sure that I have a gauze pad and possibly a piece of tape or a Band-Aid also. So when you're removing the tape, you want to be sure not to tear the skin of the patient, which is more likely to happen in the elderly. So you want to keep the IV site, the hub intact or stable, and you want to slowly remove the tape. You want to be sure not to cause any irritation of the skin. This can be difficult. You're going to place the gauze over the site. You're going to pull out. You're going to inspect the hub and catheter to make sure that there's no errors, nothing's left in the patient. You're going to apply pressure for up to 5 minutes is safe. If necessary, you could add a piece of tape, or you could ask the patient to hold it. You can apply sterile dressing if needed. The next step is to document the procedure, how the patient dealt with the procedure, if the patient had any skin problems related to the IV, and that's it. Thank you.